Afternoon to you with Newsfeed. I'm Stephen Curtis. We'll move away from the Zondo Commission and look at what's really the other big developing story today. Around World AIDS Day and across our continent, millions of people battling to get access to proper drugs to protect themselves from the impact of HIV. In the DRC, for example, huge disruptions to HIV testing. Millions of people don't know their status. There is a risk, of course, that then impacts the number of people living with HIV further. Dr. Annalisa Tetteh is a medical doctor at the Health Avail Medical Service in Ghana. Dr. Tetteh, good afternoon to you. I do appreciate the time. How badly has COVID-19 disrupted testing for HIV? Are we finding that normal services across our continent, normal HIV services, just haven't been available for the last 2 years?
Good afternoon, and thank you for having me. Well, I think that with COVID came a halt to everything, not just with HIV, but with almost everything, and every focus was on COVID, especially when there was no vaccine. So it was on testing, research, and then now that we have the vaccine, every focus is on getting as many people vaccinated so we can get herd immunity. So yes, there has been a disruption to HIV in that regard. Aside that as well, governmental, individually, there has been a disruption because people are supposed to go for their medications from the hospitals and clinics. But with COVID, most people are scared that when they go to the hospital, they may get COVID. And you know, people with HIV already are scared that their immunity is very weak. So with the new infection and the new wave of COVID and all the variants that are coming in, people are actually shying away from the clinics and the hospitals. And so yes, some HIV cases are getting worse, progressing to AIDS and all. So yes, COVID has affected HIV, its testing and then the treatment as well.
I suppose it's very difficult to estimate how many people are affected, and the number of people being affected just increases over time, not just because there are more people who want to go for a test and can't, but also because people who are living with HIV may be spreading the disease through no fault of their own because they don't know their status.
Yes, that's very true. It's very, very difficult to get the numbers because, you know, you have to do pre-counseling before you actually test people. So even when they have signs and symptoms that make you suspicious that they may have HIV, you still need to get their consent. And most people are scared of even taking the test because it's a life-changing answer. If it's a no, it's a life-changing answer. If it's a yes, it's a life-changing answer. So most people are very hesitant. And so most people would rather live than not know their status. So yes, it's very difficult to get the numbers. So we're able to get estimates at least, but it's difficult to get the actual number of people living with HIV.
It also means then that we need to start looking at some sort of measures to implement. I mean, are there any particular measures we need to implement now? And on World AIDS Day, we'll be talking about HIV here in South Africa and across our continent. But I worry that tomorrow we'll be back to COVID, the fourth wave in Omicron.
Yes. I mean, you're not far from right. COVID has taken over everything. Yes, we still need to do the education that we're doing. Sorry. We still need to do the education that we're doing because that's the only way. And we still need to do everything to remove the stigma against HIV. I almost said COVID-19, against HIV. The other issue, too, is that since 2016, the World Health Organization has directed that treatments for HIV, that's the antiretroviral drugs, should be free. It's about 187 countries have actually implemented this as of June 2021. So that's a step in the right direction because that's accounting for about 99%. And two-thirds of the people living with HIV are actually Africans. And so that's good for us. So that's a measure that's a step in the right direction. And I think that we need to encourage more countries to come on board. And that would be good because with the stigma associated with HIV, you don't expect people to go to the clinic and then buy the medications as well. Another measure that needs to be fully enforced is the fact that rapid treatment after diagnosis. So sometimes when you tell people that you are HIV positive, they would want to go home and go and think about whether or not they want to come and take the antiretroviral therapy. But now, as soon as you diagnose them, as soon as you counsel them and they are ready and willing to take the medication, you start it immediately. And that was a directive that was given as well. And I think that as of June 2021, about 87 low and middle income countries have implemented this. So further education, further push, further enforcement by all these health agencies and countries is a step in the right direction to help reduce the numbers.
The United Nations has made dealing with HIV, and particularly on our continent, a priority. They've been distracted like everybody else. It's possible that in the rich world, COVID-19 starts to come under control. I'm going to come to vaccinations and people living with HIV in a moment. But do you think the United Nations is going to change focus back to HIV, or are you worried they'll just be distracted by something else?
Well, I am worried because we're all worried. COVID, we thought, okay, it was a bit down, and then there was a new variant. So now, how many more variants are we going to get? How many more lockdowns are we going to get? We're done with 2021. We're going into 2022. And of course, that's the pandemic. So that's what we are going to deal with. If you've noticed, we've been living with HIV for a very long time. So it's become like a part of us. And so we make noise on World AIDS Day. And aside that, there's, like you were saying, tomorrow we're going to go back to COVID because, of course, that's what is the pressing issue now. So in as much as most organizations are doing their best to try and reduce the numbers or implement things to make things comfortable for people living with HIV, it's still not going to get as much focus as COVID-19, and that's in all honesty.
The scientific advice that I've been given and what we've been told from some of our scientists here is that there's actually quite a lot of data about people living with HIV having COVID-19 vaccines. Most of the research, I understand, has been done on the Pfizer vaccine. And basically, if you have a CD count of over 200, it shows that the vaccine works for COVID-19. The recommendation is if you're living with HIV, you should then have the COVID-19 vaccine. The problem, of course, comes if you have a CD4 count of lower than that. In other words, your immunity system is very, very weak. The reason I say all of this is that in countries with weaker healthcare systems, as they start to roll out, hopefully roll out COVID-19 vaccines, it's going to be quite difficult for them to convince people living with HIV and to manage people with very weak immune systems, low CD4 counts, through this process. It's going to require quite a lot of resources.
Yes, it is. Resources is a big issue. Finance is a big issue. And of course, education is a big issue. In our part of the world, it's not just about the information, but it's also about debunking the myths that exist. We have a lot of cultural myths, religious myths that people are living with and that people believe, taking of herbs and all of that. So that's also a challenge. But we're trying our very best. We're talking to people. We're encouraging them that this is the directive, take it. But you see, a challenge has also been that research is not very solid on all of this. So today they say this, we think that is actually the right thing to do, and tomorrow something else comes and we have to change it. So we can't really blame people when they're a bit hesitant with the information we give to them. We just keep encouraging them and speaking to them because, of course, we've had so many varying opinions on a lot of things before we finally settle on what to do. So we can't really blame people. All we can do is encourage them, educate them, and do the very best we can for them. So that's what we're doing.
Dr. Tetteh, thank you, from the Health Avail Medical Service in Ghana. I really appreciate the time and appreciate the work you're doing on World AIDS Day.